Just sit your head right there for me.
Children are the same all over. They can get hurt.
This looks like it's healed just fine.
But it's how they and their injuries are treated that can make the difference.
I wanted my children to be somewhere where they felt important and they weren't rushed through and treated individually, and I feel that they get that here.
For all patients, young and old, who come to Indiana Health Centers at Kokomo, it makes no difference if it's an urgent or a planned visit, whether the need is to remove stitches, get a procedure, a checkup, or receive chronic disease care. It makes no difference if the patient has $1 or $100, has insurance or not. The care and the compassionate welcome is the same. Indiana Health Centers is a one-stop medical and dental home, providing a complete line of primary medical and pediatric care, convenient and affordable. There are 360 degrees of care within the walls of this building, including full dental services, a WIC program for women and infants, and on-site lab facilities.
The mission of Indiana Health Centers is to provide quality health care at a low cost. I think what sets Indiana Health Centers apart is the passion of the people that work for us, the mission. They believe it. We want to make Indiana Health Centers the medical home for all of our clients.
That means hours and services here are consumer-driven. Indiana Health Centers at Kokomo is open 49 hours a week, 3 nights a week until 8 p.m. and Saturdays until 2, hours that community members choose to fit their needs. Indiana Health Centers is also unique because it is governed by a board of consumers and community members like Bob Hayes.
That's one of the reasons why I wanted to be on the board of directors for this organization, because we are really, truly making an impact on a ground level, a grassroots level. We're really helping people.
Each morning, social service case managers Maria Leha and Sarah Patterson start their day discussing patient needs that may have slipped through the cracks, finding out why patients have missed appointments, are homebound or unreachable.
She's missed 4 appointments in a row.
It is help that still includes house calls.
Up until you get back up on your feet, they may have me come out another time and check on you and stuff. You know, they're gonna have to amputate it.
We only see in the clinic what they're here for. But when you're out there, you actually see there's no food there. They don't even have refrigerators, or they don't have, running water.
She's doing fine, like we had hoped, and she didn't lose that other leg, and that was the main thing.
In 1977, Indiana Health Centers at Kokomo began serving the unmet health needs of people in Howard and surrounding counties, initially as a health center for migrant farm workers. At the behest of the local community, IHC brought the WIC program to Howard County. With federal assistance, it became a community health center in 1981. In 2000, IHC moved to this newly renovated clinic building on Kokomo's near west side. For the uninsured and underinsured, it offers services on a sliding scale, up to a 90% discount for those with lower incomes. It also accepts most insurance, as well as Medicaid and Medicare, and it regularly helps clients enroll for Medicaid and other social services. Now, 30 years later, more than 7,000 clients a year walk through these doors and call this clinic their medical home, including Marilyn Miller.
Has your blood sugar been doing okay?
Marilyn has been without insurance for 32 years. She's had 2 heart attacks and suffers from diabetes, hypertension, congestive heart failure, and arthritis.
Where would you be if there wasn't an Indiana Health Center?
In a grave. I would not be alive. I've had no insurance, no kind of medical help till I come here. And so, I would not be here if it wasn't for the health center here. So I really appreciate it and, what they've done.
Nurse practitioner Grace Stanley and Marilyn have bonded in the 20 years she's been a patient here.
She has been more like a friend than a doctor.
With the assistance from here, she has been able to do well.
6 weeks old. He sure looks like he's gained plenty of weight.
Yes, over 16 pounds.
That's great.
That includes new mothers and children. IHC at Kokomo's WIC program serves around 2,500 clients. WIC is a supplemental nutrition program. With registered nurses, dietitians, and a lactation counselor, it provides new mothers with dietary and nutrition education, support groups, and advice on pregnancy and infant care.
There are so many advantages to breastfeeding a baby. Less ear infections, less upper respiratory infections, happier baby, easier to soothe. Long-term benefits, absolutely. Obesity is reduced as an adult, Crohn's disease, childhood diabetes, asthma, the money that is saved over the course of the first year of breastfeeding.
And that's a savings of $1,000 if mothers breastfeed their babies. In pediatrics and internal medicine, the POD system teams a doctor, a nurse, and a triage assistant to maximize consistent care, communication, and efficiency for patients. Medical Director Dr. Laura Mangus says patient education and early intervention make for good results.
We try as much as possible to keep the same patient with the same primary care provider, you know, assuming that person's in the office at that particular time. And as a result, you know, when that patient calls in with a concern, you know, all of the people on that team are already very familiar with that patient, and that also makes it better, I think, for the patients.
That includes adding services to make the clinic a one-stop medical and dental home.
Could you possibly put a partial in there to fill that gap?
Yeah, we can get you some information on that, sure.
Yeah, 'cause,
a new dental practice in 2002 provides a full range of dental services with a licensed dentist, 3 dental assistants, and a hygienist.
Parents bringing in their children can't run from one medical office to a dental office to all the places they have to go. So we make it very easy for people who are busy with other things in life to bring their children in, get a medical appointment and a dental appointment at the same time.
Early intervention makes for good medicine. It can prevent dental disease in children and help detect and treat chronic diseases in adults. The dental practice here has seen huge growth to more than 3,000 patients a year.
People come here and they know it's going to be affordable. That's the main reason. And they know they're cared for and they know they're loved, and anytime you put all that together, our practice is going to grow.
Indiana Health Centers serves 65,000 people through its statewide network. CEO Lynn Clothier says the key is quality health care. And that starts with the unique, dedicated people who work here.
All of the providers are board certified in their fields. They choose to work with a caseload of 100% vulnerable populations. The people who choose to work at Indiana Health Centers are interested in making a contribution, not just getting a paycheck.
That spirit of commitment, that mixture of passion and compassion, that personal sense of mission are what make Indiana Health Centers at Kokomo what it is.
We are providing them a quality service, a quality health care, and I think that's what sets Indiana Health Centers apart from all other medical providers in Kokomo and Howard County.
I enjoy it so much, and it doesn't feel like a job to me.
I really love this because we're helping people who really need help.
Indiana Health Centers at Kokomo, community medicine, filling the gaps and making a difference, providing high quality, accessible, and affordable health care to those who need it most in Howard County and beyond.